Hello everyone, welcome. In today's video, we will study about some of the general drug categories which will be base of our understanding for the future videos to come. We will not dive deep into this topic today and leave it for when we will study a specific category in more details like their effects, interactions, mechanism of action with examples. In the healthcare system, drugs had been categorized in many categories such as according to origin, according to law, according to prescription, according to chemical structure, and etc. and many more. It is due to different requirement of different healthcare professions which contribute vastly to this system. Today, we will study some of the categories in therapeutic classification of drugs. Let's study about some of the general or common drug categories. Let's start. So first we have antihypertensives. These are medications that lower blood pressure. It includes diuretics, beta blockers, calcium channel blockers, ACE inhibitors, centrally acting antihypertensives, and sympatholytics. We will know about them in more details in the future videos. So let's move on. So the next drug category is anti-inflammatories. These are drugs that reduce inflammation. These are useful in conditions like rheumatoid arthritis, gout, and many more. Next drug category we have anti-neoplastics. These are medications for treatment of cancer. Antipsychotics. These drugs are used for several psychotic disorder, also known as major tranquilizers. Next we have antipyretics. These are medications that reduce fever. Next drug category is antivirals. These antivirals treat viral infections and provide temporary protection against disease like influenza. Next we have beta blockers. These reduce the heart oxygen demand by slowing the heartbeat. Next we have bronchodilators. These relieve narrow bronchioles, easing breathing in conditions like asthma. Cold cures. While not a cure for common cold, symptoms can be alleviated with aspirin, acetaminophen, which is paracetamol, decongestants, antihistamines, and caffeine. Sometimes we can use it for treatment of cold. Next drug category we have corticosteroids. These are hormonal drugs used as anti-inflammatories or immunosuppressives and for treating certain cancer or hormone deficiency such as in Addison's disease. So the next category of drugs we have analgesics. These are used to relieve pain and these have two types, that is non-narcotic. These are used in mild pain, and narcotic, which are basically prescribed by doctors in case of severe pain. Next drug category we have antacids. These antacids are used for neutralizing stomach acid and to treat indigestion and heartburn. Anti-anxiety drugs. These drugs suppress anxiety, relax muscles, and also known as anxiolytics, sedatives, or minor tranquilizers. Next, we have antiarrhythmics. These drug category are used to control heartbeat irregularities. Next, we have antibacterials. These treat bacterial infections and they are effective only against bacteria and do not work on other microorganisms. Next drug category we have antibiotics. These combat bacterial infections, and antibiotics can target a wide range of microorganisms including bacteria, some fungi, and certain parasites. These have some types: limited spectrum or broad spectrum. Next drug categories we have anticoagulants and thrombolytics. These anticoagulants are used to prevent blood clotting and thrombolytics are used to dissolve blood clots. Anticonvulsants prevent epileptic seizures. Antidepressants. These are mood-lifting drugs. These have some groups, that is tricyclics, monoamine oxidase inhibitors, and SSRIs. Next we have antidiarrheals. These antidiarrheals provide relief from diarrhea and these have some types, that is absorbent substance and slow bowel contractions. Next drug category we have antiemetics. Antiemetics are used to treat nausea and vomiting. Next drug category we have antifungals. Antifungals are used to treat fungal infections and these commonly affect hair, skin, nail, mucous membranes. Next, we have antihistamines. These counteract effects of histamine. These are used for allergic reactions. Next, we have cough suppressants. These are simple remedies like honey, glycerin, or menthol that soothe the throat but don't suppress cough. Most effective as lozenges. Liquid may be less effective due to rapid swelling. Two main types: mucolytics and expectorants modify phlegm consistency or production. Codeine, antihistamine, dextromethorphan, and isopropanol suppress the cough reflex. Next drug category we have cytotoxins. These drugs destroy or damage cells, used as antineoplastics for cancer treatment and as immunosuppressives. Decongestants. These reduce mucous membrane swelling in the nose by constricting blood vessels and elevate nasal congestions. Next drug category, we have diuretics. These increase urine output from kidney, removing excess body fluids, addresses fluid retention in heart, kidney and liver disorders, beneficial for mild hypertension management. Next drug category, we have immunosuppressives. These reduce body reaction to disease or foreign tissues, treat autoimmune disease and prevent organ transplant rejections. Next drug category, we have laxatives. These increase bowel movements frequency and these have some types that is stimulants, bulk or stool softeners. Next drug category, we have muscle relaxants. Muscle relaxant elevate muscle spasm, commonly used for backache relief, often coupled with anti-anxiety effects. Next drug category, we have sedatives. These sedatives are equated with anti-anxiety drugs and induce calmness and reduce anxiety. Next, we have tranquilizers. These are generally refers to drugs with calming effects. Minor tranquilizers are more accurately anti-anxiety drugs, and major tranquilizers should be referred to as antipsychotics. And the last drug category of this video, we have vitamins. These are essential chemicals needed in a small amount for health. Not all vitamins are produced by the body. Most are obtained from normal diet. Supplements may be necessary for those with inadequate diets or certain health conditions. So, these were some of the general drug categories which are commonly used by doctors, pharmacists or nurses, and even some normal citizens may know about them. Some of these drug categories have subcategories providing better options for healthcare professionals to treat or cure the patients. If you want to know more about drugs or medicines related things, subscribe to this channel. We will bring more videos in the future. Thank you for watching.